I shall be continuing with infectious diseases in rats, racing against time for students in pathology. First is a case history. Let us see what it is. Multiple persons who were working for a concern in the early 20th century successively became sick. They have had food from the same mess. They developed a step-ladder pattern of fever, and two of them died on different dates within a short span, probably due to different causes also. So, an autopsy was performed on each of them. What do you think is the probable clinical diagnosis? Explain the pathogenesis and lesions of the disease. Add a note on the complications and the investigations. I hope you people are able to guess. So something that is common is food. There is a same source of it. Multiple persons. So these are all some keywords we shall have in mind. And this is an excellent person who has hit history on the wrong side. Mary Mellon, popularly called or unpopularly called the Typhoid Mary. And she was a cook who was working in that concern, serving the people, and because she was a carrier, they all developed typhoid. What are the predisposing factors for typhoid? Remember these F's: food, fluid, flies, fingers, fomites, feces. So my professor used to call these as 6 F's. Remember this. These can be the modes of conveyance or the vehicles of infection. The topic for the day is enteric fever, otherwise called typhoid. The importance of it is given in the enclosure. The subjects covered are mentioned. Typhoid fever. It is called the king of factors on a stage of disease. Very beautiful word. Not mine. King of factors on a stage of disease. And see what this is going to tell us. A case of typhoid fever may present as a disease clinically indistinguishable from malaria, progress to a bacillary dysentery, mimic an acute bronchitis, simulate a full-fledged lobar pneumonia, cause an acute abdomen with perforation, and then finally in convalescence, that is recovery, with its evil spent, linger on us as orchitis, myocarditis, and peripheral neuritis. Very superb description of the entire sketch of typhoid by Ronald Huckstep. Superb. I would like you people to kindly memorize it. It is worth it. Sometimes these are all words of gold that should be borne in mind. And in the history, you find that typhoid is as old as mankind, probably as leprosy itself. And these are all the various people. Antonius was 2000 years back treating an emperor. Thomas Willis identified this as an epidemic affecting large groups of people, maybe like corona and so on. William Woodheart, and he distinguished the differences between typhus and typhoid in 1837. And Carl Ebert, he identified the typhoid bacillus in 1880. There are two organisms, namely Salmonella typhi and Salmonella paratyphi. So look at this one. These are all organisms which are short and stout, and they are all flagellated, moving around. Gram-negative, flagellated. And this is a sketch of it to just show. Beautiful. This particular picture, forget all the other things, but this you should remember. The pathogenesis, and this is the source of it, thanks to them. Please follow what I am trying to describe. These are the mucosal cells of the intestine. In the intestine, you have got a mucosa and then submucosa, muscularis, and then serosal layers. These are the mucosal cells. The mucosal cell is destroyed, and then you find that this organism, Salmonella typhi, it enters. And it is being engulfed by the macrophage. It is being taken inside. This is a macrophage that is going inside. It is carried in the lymphatics. It goes to the mesenteric lymph nodes. The mesenteric lymph nodes are involved in typhoid. They are rubbery in consistency. From here, they can spread to various organs such as the spleen or the liver. I repeat once again, mucosa is affected and the organism, it is devoured by the macrophages. It stays within the macrophage. It is carried via the lymphatics, affects the mesenteric lymph nodes, and then carried to the parenchymal organs such as the spleen or the liver. This is the first phase, after which it generally multiplies in the gallbladder and via the gallbladder. So you find that there are numerous bacilli over here. It is again carried back by means of these macrophages to what is called the Peyer's patch. Peyer's patch is nothing but a lymphoid follicle, which I shall be showing again. So there is a proliferation, there is a hemorrhage, there is an ulcer that can develop. So this will be the pathogenesis of the typhoid bacilli or the enteric fever. Please do remember, it will be extremely important, and I hope you people will be able to describe this. And the same thing is mentioned over here. So I would like you people to go through it. So it is ingested and it is invaded into the lymphatics or the bloodstream, carried to the parenchymal organs, multiplies, re-enters the bloodstream and comes via the gallbladder, etc., into the intestine where it causes an ulcer. I hope you people are able to remember this. Well, this is important. Antigens. What is an antigen? An antigen is a protein which, when introduced into the body, leads to the production of antibodies. And it is responsible for the virulence of many an organism. So this is the typhoid bacilli, Salmonella typhi, along with the flagella. The flagellum itself can contain an antigen, and that is called the H antigen or the flagellar antigen. The blue color is a capsule. So there can be a capsular antigen. And it is responsible for the virulence, and hence it is called the virulent antigen made up of polysaccharides. It protects the organism from the antibodies. And then last one will be the somatic. Somatic means body. So the O antigen is the somatic antigen. These three antigens, kindly remember, draw this picture. The carrier itself can be of three types. One can be during convalescence, the patient can be a carrier. In the feces, he can be carrying the organism, or in the urine. These are the three different types of carriers. We shall be remembering it later on for completing the cycle. What are the lesions that we see in a case of typhoid? As I told you earlier, in pathology, lesions are mandatory in infectious diseases. You find that there will be ulcers overlying the Peyer's patches. Patient can develop perforation and peritonitis. Mesenteric lymph nodes can become enlarged. I mentioned it earlier. They are pink and rubbery. Hepatosplenomegaly, for the reason that we mentioned earlier. Sometimes there can be a granuloma, which is called the typhoid nodule. There can also be a Zenker's degeneration and myocarditis. You will have to memorize this particular list, though I'll help you to do it so. So this is a muscle which is undergoing a degeneration. ZD means Zenker's degeneration. Classical of typhoid. There can be some cells such as the histiocytes over here, which are present. There is a degeneration of the muscle. Zenker's degeneration, a very commonly asked MCQ. Even otherwise, when you write, you score a mark for it. What are the signs? So always a symptom is a complaint that the patient comes with, sign is what you elicit. There is a bradycardia, that is a slowing of the heart rate, malaise and headache. Leukopenia, when you see the blood, the WBCs are decreased in number or not increased to the extent. Faggot sign is there, dicrotic pulse, bronchi, and during the third week there can be intestinal perforation or hemorrhage. So look at this one, you find that there is a pink rash or a rosy rash that can be seen over the trunk. Increased in a case of paratyphoid, lesser in typhoid. And there is a sphygmothermic dissociation. Normally what happens is whenever the temperature increases, the pulse rate also increases. But then there is a dissociation. In such patients, you find that temperature will be increasing. You will be seeing in the subsequent slides, but the pulse is not relatively increased. And that is called Faggot sign. And dicrotic pulse is abnormal cardiac pulse with a low cardiac output. These are all signs that you can see in typhoid. Again, a very important line diagram. I hope you people are able to remember this one. There is ingestion of the organism, and then there is an incubation period over here, and the mesenteric lymph nodes are enlarged. There is an involvement of the lymph nodes over here. In the intestine, there can be the Peyer's patches which are affected. And later on, there can be the blood that is involved, leading to the involvement of the lymphoreticular system. And there is a re-entry into the intestine which will lead to a typhoid ulcer classically. So these are the stages I would like you people to remember. Bacteremia initially, there can be organomegaly and there can be ulceration. Finally, the patient can become a chronic carrier as in the case of typhoid Mary. So this particular diagram, if you people can remember, this is one of the best diagrams I would like you people to kindly remember, and the credit goes to labpedia.net. This is what I wanted to explain. In the intestine, you have got a follicle called the lymphoid follicle. The lymphoid follicle means it is a group of lymphocytes. The small dark ones are the mature cells in the periphery, and the paler cells are the immature cells in the center. Normal lymphoid follicle. Now this is affected. So sometimes there can be a reinfection of the lymphoid follicles. Once it is there, it is called a Schwartzmann phenomenon or a kind of reaction. So what happens is this lymph node is replaced by histiocytes and it bulges, as a result of which there is ischemia and ulceration in this region. That is why in typhoid, the ulcers will be overlying the Peyer's patches. Erythrophagocytosis is a classical histological sign. So remember these ones. Affection of the lymphoid follicle, there can be a reinfection called Schwartzmann phenomenon, there can be erythrophagocytosis, and there can be ulceration of the mucus. Beautiful pictures. This is for you to draw, this is for you to enjoy. So you find that the ulcers are linear, they are long, with the long axis parallel to the long axis of the bowel, because the Peyer's patches are arranged so. So this will be the morphology of the Peyer's patch. Since the ulcer is overlying the Peyer's patch, you find that there are longitudinal ulcers with the long axis parallel to the long axis of the bowel. And I get a black color because of the necrotic debris that is found on the floor of the ulcer. So superb specimens, look at the way they have preserved the specimens. These are elongated typhoid ulcers with the long axis parallel to the long axis of the bowel, and this is one. And this is something that you people should always remember. Meckel Museum is one, but I am more interested in this one. Sir William Osler, he was a physician, but then he is a gentleman who has said, as is your pathology, so is your medicine. Superb collections, and I hope you people will be able to remember it. They are not mine, the credit is given to the respective centers. Signs and symptoms. The rose red spots I had mentioned earlier, they can be fading on pressure. Step ladder pattern of fever. I had given this in the history also. You find that there is a progressive increase in the temperature. Initially it starts and then progressively increases. And so you find beginning of the day it can be more, towards the end it falls. So there is a step ladder pattern and it reaches a peak, after which there is a convalescence, lysis of the organism, and there is a rapid recovery of the normal temperature. Dullness and confusion can be there. Meningism is a disease of the meninges, not meningitis. Splenomegaly can be there, tenderness in the abdomen, and stools can be soupy. There is no diarrhea as such, but it can be present. And the laboratory investigation, these are the graphical forms. You find there can be blood culture, bone marrow culture can be there, blood culture can be there, which later on falls. There can be agglutination test or the Vidal test. Urine and the stool cultures also can be positive. So please remember this one. And leukopenia means there is a fall in the WBC count. And this is a agglutination test designed by Vidal. So you find that there will be, this is a progressive dilution that we make, and we find at what dilution it is positive for the patient, and we give the result accordingly. So it is an antigen antibody agglutination test. So this particular diagram, again labpedia.net, I would like you people to kindly draw. Initially, the first test that is positive will be the blood culture. Don't answer Vidal. Vidal will not be positive. It is a measure of the antibody. It will take some time for your body to develop the antibodies. And after some time, the third week, etc., the blood culture is negative, urine culture also becomes negative. But your Vidal test will continue to be positive. That doesn't mean you are having the disease, but your antibodies are present. So this particular diagram, I would like you people to kindly draw in your answer sheets. And this is again a summary of the same. Please write this. What are the complications? There is many a complication that can develop. I have divided into medical complication and surgical complication. Amidst the list, I would like you people to kindly remember this: bronchitis, pneumonia, myocarditis. Sometimes there can be a cardiac arrest also. Zenker's degeneration, I had shown you a picture of. Deep vein thrombosis. Please remember these 5 as medical complications. Surgically, there can be intestinal perforation, hemorrhage. It can be fatal. Gallbladder is infected. Therefore, there can be cholecystitis. Strangely, there can be osteomyelitis also in typhoid. I repeat once again: bronchitis, lobar pneumonia, myocarditis, Zenker's degeneration, deep vein thrombosis, intestinal perforation and hemorrhage, cholecystitis, osteomyelitis. The other causes, if you can remember, well and good, but at least these you must. So clinically, these are the things that we had seen. Bradycardia, so there is no increase in the heart rate. And this is a step ladder that is given there. So you find that there is a step ladder pattern of fever that is seen in typhoid. The cause of death can be because of shock and ARDS, adult respiratory distress, or there can be perforation, peritonitis, hemorrhage. Myocarditis and cardiac arrest can be present. So in the early stage, it is shock and ARDS. Late stage, these can be the causes for death. And not a way to make history. I hope you people can identify somebody whom we are talking about all this time. And this will be the Typhoid Mary. Many movie had been brought out of her, and supposed to be a deadliest hook, etc. So they are all different ways of describing it. Gracias.